Доброго дня, шановні колеги.
Good afternoon, dear colleagues. We greet you all with the Armed Forces of Ukraine Day, and today we are going to announce a volunteer project that is called BloodMobile. And today we have Rostyslav Zauralskyi, project initiator, advisor to the Ministry of Health of Ukraine. He has PhD in medicine and member of the board of the Association of Therapy and Specialist of Ukraine. Oksana Tiupa, head of Dyvosvit Club Charity Foundation, and Maksym Ryabokon, coordinator of all-Ukrainian Volunteer Center People's Project. Today, we are going to speak about this project, this history of its creation, and the main problems we face in the realization of this project. Then we will have a Q&A session. And now I give the floor to Rostyslav Zauralskyi. Good afternoon. First, I would like to thank the audience for being today with us at this press conference. The topic we are going to discuss is really important and complex. I am also a transfusion therapist, so we transfuse blood, and we know the issues concerning problems connected with blood transfusion, and in the ATO area, injuries are connected with the blood loss, and many servicemen may die because of this blood loss. That's why availability of blood is an important issue. We need to have storage of blood, and if a serviceman needs transfusion, he should get this service. So the components of blood it is difficult to store and transport them because we have a special temperature regime, so it should be kept in special premises. So if plasma is unfreeze, so it is impossible to use it. That's why storage of blood in hospital is available, and also there is storage of blood in medical institutions, but the storage of blood mainly is used in hospitals, and we are the country that is in war, and we started a project, and the motto is of this project is that we should provide blood to patients. The components of blood should be transfused, and in this case the patient has better chances to survive. And if we are speaking about temperature regimes, for 1.5 years, even more, we created a special vehicle that travels around ATO area, about 50,000 kilometers, and we bring blood components from Riga, Kremenchuk, Poltava, Kharkiv regions, and we bring blood to the area where blood components are really necessary. We transfused 100 liters of blood components, And theoretically, we could save many lives. And components of blood, they need to have temperature and time regime, so they can be stored only for 30 days, and we use we dispose the supplies that are not necessary, and freezed plasma, it should be kept not more than 1 year, and I cannot say exact number of servicemen we helped, and there were many stories when we transfused blood, and blood is really saves lives, and no one can replace blood, so no one can create such a substance. So now we do it all in war conditions, and these projects will continue after war ends, because this is medicine of catastrophes, and there are catastrophes during war, but there are also technogenic catastrophes, some emergency situations, and we work on the concept. So we work on the concept that doctors can bring blood to patient, and this is a large-scale project with good future, and there are no such projects. We didn't find such examples in other states, so we try to do it in our country. Thank you, Rostislav. And now there is a video about our BloodMobile. War is death. So people got injured, and there was information that there is lack of blood at the front line, and we were thinking, how can we help ATO servicemen, and we created a special center to transport blood where it is needed, and the main problem was the vehicle. This is the latest modernized vehicle. In this vehicle there is a special chamber. We can put 5 package with blood here, and then the military can bring an injured person to this BloodMobile. So we start to transport the patient, and the plasma, it will help to save lives of the servicemen. So this is a mobile hospital, and it has been in war for more than 2 years, and I don't even know what was the amount of, the number of people we saved. This is an emergency room. In this bus there is storage of plasma, and this is BloodMobile. Everyone knows it in ATO area. It covered more than 40,000 kilometers. We faced many emergencies. They call us and they say that they do not have blood. So we take this from the blood centers. Then we have special facilities in order to store this blood. The main reason of death of those who were wounded in the military zone. So this is blood loss, the main reason. That's why this person, they shouldn't just be brought to the hospital. We should not lose time. We do it in some minutes, and we carry out emergency procedures, and this is the matter of life. and I am in the ETO area from 2014, and I was wounded, and I was dying because of blood loss, and they started to transfuse blood near helicopter, and they did everything to save me. In 2 years, we provided components from 270 donors. They provided supply of blood, and we do not use aviation, so we bring doctors to patients. If we lose blood, we should restore it, because blood saves lives, because patient dies of blood loss. That's why we should stop bleeding and then to transfuse blood to the patient. So we will implement the same things in medicine of catastrophe in civil life. So a patient shouldn't die because of a loss of blood. So this is a very needed thing. And those who will watch this video, please, you should help, because now these are times when we should help each other. Thank you for this wonderful video. Thank you. And next, the floor is given to Oksana Tiupa, head of board, Charity Foundation, Dyvosvit Club.
I would like to congratulate our defenders, our soldiers, with a professional holiday. And now I would like to describe our project. This is the national project. So first, our stage is fundraising. We raise money to buy the BloodMobile, a special car which will travel along the front line. The second stage for our fundraising will be a purchase of special equipment for this mobile. And the third stage, we will use this experience of the first and second stage and prepare more such BloodMobiles. By the way, such BloodMobiles, they might be useful not just for the front line, but also for the emergency medicine, paramedicine, etc. Also, I would like to inform you that the first stage, aiming to raise 500,000 hryvnia, will be aimed for purchase of very special equipment. This chilling equipment, blood operations equipment, etc., special containers for transportation, even special fridges, etc. We plan to finalize the first stage within 3 months. I would like to mention who are our partners in the project. We have the Association of the Young Blood Donors of Ukraine, and we have another partner, the media platform, all-Ukrainian Union of Volunteers, and also our club, Dyvosvit, which is administering this project. So these are our co-organizers. With this, I would like to finish and to give the floor to one of our partners who has been doing much for our servicemen at the front line, Maksym Ryabokon. coordinator of All-Ukrainian Volunteer Center People's Project. Thank you for attending our today's briefing. We have selected this day for our media event because this is the National Day of Armed Forces, and I would like to emphasize that our servicemen at the front line, they need very much such BloodMobile. Our association, our volunteer center, was created back in 2014, and we during 2 years of our existence, we implemented almost 40 projects amounting to 140 million hryvnia. These were the projects in the area of military medicine. We contributed to the development and reform of the Ministry of Defense, and we contributed to training projects for our military staff in the armed forces. Now we are involved into the project with the BloodMobile. I think that it is also primarily important. Now I have to state that today our army is in better condition than it was in 2014, but nevertheless it is not the perfect situation, and by February we our target is to raise almost 500,000 hryvnia to buy this BloodMobile, which is so much needed to rescue lives. I also would like to mention that we are very transparent as financial manager, and we have good reputation in this area. That's why we encourage you to be involved into this project. We invite donors and sponsors, and we invite also Volkswagen and Mercedes companies who might become partners or sponsors in this project, which might contribute to the aid to Ukrainian servicemen. This is our website, via which you may contribute money. From now on, we start to raise money from to raise money for this BloodMobile. If you have any questions, feel free to ask us. Maria, UCMC. How many such BloodMobiles you plan to launch in general? As of the moment, our first objective is to revive the existent fleet of cars, of ambulance cars. The cars which you see on the you saw on the pictures, they were produced by amateurs in amateur garage, and quite often the big amounts of blood was rescued, was risked, and we had to rescue it in the emergency situations in Slaviansk, for example, close to the front line. So we have now to ensure the reliability of the system. We need to have donor. We have the special storage facility, the special hospital facilities, and then the consumers of this blood. And this time we need to deliver this blood to the front line and to ensure proper conditions for this delivery. Now we know clear figures, definite figures. One such car will be purchased very soon. Also, the second car will be equipped to deliver aid very close to the front line, and 4 more cars will be equipped with a special blood equipment later. We believe that this will be a national project since we wish to continue it as part of the emergency medicine development. Thank you. There are no further questions, dear colleagues. If you have, in case you have any questions, feel free to contact me. Thank you.